My understanding is it can actually make you sick over a long period of time.
So you're a woman.
Okay? Yeah.
Why?
Well, you've got more foresight than Vanessa
About what?
about the needs of a cripple.
Oh, okay. Okay.
Hello. Hello.
Hey, how are you?
Good.
Yeah, Kathy telling me.
Yeah, it's a dad.
So you're having chemo?
Yeah, I've had 3. This is my third treatment.
Oh, nice.
So is that, have you,
I said to David, you can see the family resemblance.
so has that fallen
Yeah.
out, or you've done that yourself?
It
I
was falling
shaved
out in
it.
handfuls.
Okay.
It was falling out in handfuls. I had it cut shorter because it was.
Yeah.
I had been growing it longer, but it was falling out in such big, like
Yeah.
every time it was. I had it over
Hey,
every my clothes.
Don't feel bad,
Yeah.
because I'm now getting sunburnt.
Oh
right
wow!
there.
Wow!
Oh, I'm going bald.
Yeah. Well, I'd be interested to have white hair when it grows back, but who knows what colour it will be for a while.
This is pretty white.
Yeah.
Do you want any more? Yeah.
No.
Put
No,
that in
no,
the
we're,
fridge.
this is for Johnny.
Johnny.
John?
No, mate, I'd love a drink though.
You want lemonade?
Yeah, that'd be cool.
Yeah. Anyway, so
You're sounding pretty bubbly.
Very good.
Well, I
You're
feel
having
fine.
good days and your bad days. Or?
I'm
Back out
tired
of the
today,
sun.
but I feel quite
Not Vanessa.
like I'm not in the doldrums about it. No. Like what will be, and take every day as it comes, and it will be.
You can't do it. It's out of your hands.
I know. And,
I think you've got a pretty great dog, mate.
yeah. Well. Yeah.
Cheers.
Yeah. Well, and that it hadn't actually reached my lymph nodes yet, but still because it was aggressive and quick growing, and all of the cells were actually demarcated. They were all no longer recognisable as breast cells. They all had changed radically.
Thank God you got it when you did.
Yeah. Anyway, so so then this.
You won't know that, John, till 5 years' time.
Yeah, 5 to 10.
Yeah, five's like, yeah.
Well, and they say 5 to 10, actually, Dad.
I don't know if it completely goes away. It just lurks somewhere there and back out.
Yeah.
It either comes back or it doesn't.
But I researched Jane McGrath. You know how the pink thing. Jane McGrath she got it in her late 20s.
Yeah.
She got it. It was invasive, similar to mine. I'm not sure it was in the lymph nodes or not. Actually, I don't remember that much so far now. But she had a lumpectomy or mastectomy, whatever it was, and she had chemo, and then radiography and hormone treatment.
Yeah.
5 years later, she was declared disease-free, and the next year she got back secondaries and died within the year.
Yeah.
So you can still,
Yeah.
and she died in her early 30s.
Yeah, well you got to remember that.
Yeah.
So you
Well, they say the younger you are, the more aggressive it is.
Yeah. So if you clear this hurdle now, just keep going back and getting checkups.
Yeah, well, I would have liked to have been going annually. I was going biannually, like every 2 years. So and even delaying it for a month was probably not a good thing, given that it was
Bromley
growing
goes
up.
every year.
Pardon?
Bromley goes every year.
Yeah.
They don't. They say every 2 years, but I think that's just a ploy to not get inundated with people.
Well, they asked me, like, I've been going every 2 years since I was 40,
Yeah.
and they asked me, do you have any family breast cancer, experience of breast cancer? And I said, yes, my grandmother on my father's side died of it, and I have a cousin on my mother's side who had it in her 30s.
Yeah.
And they said, they said at that stage, your father's line is less relevant.
Yeah.
And now when I spoke to them recently, they said, no, that's not true. It's mothers and fathers. And,
I'm amazed. Just different people you talk to give you a different spin on.
That's why it's
Even doctors.
You always get a second opinion.
Yeah.
Well, even Bridie's finding out about teachers.
Yeah.
You know,
I know that in architectural profession.
Yeah.
There's architects that are absolutely hopeless.
Yeah.
And I know. And the person in the street would go, oh yeah, they're all the same, but they're not.
No, no.
Some are good and some
Yeah.
aren't so good.
Oh well, this breast surgeon, she was wonderful. I was so pleased, and you know, and she was, as I said, recommended by a friend,
Yeah.
and she was on their top list of 4 people, and I said,
Yeah.
well, I know the name Linda Cook. My
Yeah.
girlfriend has been to her, so and
Yeah.
highly recommended.
But
her.
again, the best recommendation is by word of mouth.
Yeah.
Yeah, I mean, it's
Yeah,
not.
but the actual clinic
Yeah.
recommended 4 people. So because they don't
Yeah.
want to recommend only 1 or 2.
No,
I-
they have to do that.
I can understand that.
Yeah,
John, David will tell you all that.
Yeah.
And
See?
they legally they can't spin all their business one way.
No.
Yeah,
And-
but also they won't do that either,
No, no.
because ultimately that clinic could be getting some kind of kickback
yeah.
from
yeah.
from-
And you know what? Like in our profession, we can't tell a client, we can't recommend anyone to a client.
No.
No, but-
Because if there's some sort of problem, they can sue you because you recommended
no.
them.
Yeah.
Well,
So-
and each time they've all gone and given me at least 3 or 4, and gave me the names of several chemo oncologists,
Yeah.
and there was a woman among them and 2 men, and she said she has had people who've come back to her and asked to be referred to somebody else
Yeah.
because she's so brusque and she's not very
Warm.
warm or supportive.
So not a good bedside manner.
Yeah, and
Which
I
could
yeah,
mean,
yeah.
doesn't necessarily
It
mean
means
they're
she's
a
a
bad
bad
No. And I said, well, I have no issue about a man or a woman. In fact, I want someone who's good, but I don't want to be beaten up as part of the process either. Because your relationship with them is 5 to 10 years long, even if it's successful.
Yeah. And if they're 70 now, that's not a good sign. So
no.
they might be around, so.
No, she's actually quite young. I saw her actually when at the Wesley. She looked me up and down. Anyway, and she said, and David Bryan, she's the person I'm going to. She said he is beautiful. He is very warm. He's very supportive, but he'll always run behind time. And I said,
Yeah.
That's okay, because he's
And I
spending
said-
time with his patients.
yeah, and I said, that's what I said. Well, if he's giving his time to his patients, that's fine. I'm retired. I'm not set into a work sort of
Yeah.
routine.
Yeah.
That's fine. And he has been beautiful. He's really lovely.
Well, that's good. That's good.
Anyway,
So far so good.
so far so, and Liz Kenny, the oncologist, the radiation oncologist. Like I've already got these little tattoos,
Yeah.
to where they're going to put it in, and we had already done the prep session because assuming that it would start the next week before I got the results of
Is this
the genetic
chemo?
test. Before I got the results of the genetic testing,
Yeah.
and we have to do all that again because I've lost a couple of kilos and that might affect the depth of the radio rays
Oh,
and stuff.
yeah.
Yeah, because they have to
The
protect my
strength
lungs.
of it, yeah.
They have to protect not to go as deep as my lungs. So
Yeah.
anyway, but
It doesn't feel good when they're there zapping you and they're all standing behind screens and you're just out in the open.
yeah.
So I'm the dead doctor.
Well,
Yeah.
No, but you got to understand, they're zapping 20 people
Yeah,
a day.
I know.
They're only zapping you once.
I
You're like,
I know.
they're zapping, they would have zapped thousands and thousands,
I
tens
know.
of thousands.
They're getting themselves a good dose of
Yeah.
cancer in the
Yeah,
process.
yeah.
At least they don't wear their lead aprons anymore.
No.
Oh, they do in theatre.
Do they?
Yeah.
Are they okay?
Yeah.
Yeah, but
Yeah.
no, and I had these all these little other things, including sort of hook lines and everything else they'll put in, so the surgeon could actually find exactly where the things are,
Yeah.
because apparently when you open it up, the tissue doesn't
yeah.
necessarily look any different from any
No,
other tissue.
no,
But,
You need some reference.
yeah.
points.
So I had all these hook wires and other things. So yeah, I'm having all the works and jerks, and then I had this infection sort of a little while
Yeah,
back.
well, that worried me when we got
Yeah.
the text from you to say you were in the hospital.
Yeah, well, it was this tiniest little thing on my hand. It was it was like the size of a matchstick opening.
Yeah.
And anyway, and Esther, because Ian was away, so Esther's living up, making
Check
sure
in.
Good.
I'm
Have you got your carer certificate level 4 yet?
Well, someone should pay me.
and anyway, so and Esther said this thing on my hand, because because I've been washing up and doing all these other things. I don't even know how I got it. I probably
Yeah.
just because my skin is really, really
Yeah.
thin. And,
Well,
and
It's
just-
breaking
plus
down.
your
Yeah.
resistance
Yeah.
probably,
Yeah,
isn't it?
No,
your skin's
no.
your first resistance,
Yeah,
so if
yeah.
it's breaking
So
down,
you
that's
see
where
that-
it
you
affects
see
you.
that
The
now?
outside.
Yeah, yeah.
And then in the tank
I
water
keep
doing the
cutting myself
dishes.
there, shaving.
Yeah,
Oh, okay.
you don't know
I've
what's
got
in the
it
tank.
Yeah,
Yeah,
there,
exactly. We
years
can't
ago.
drink
Yeah.
it, so
But
And
it
every
just,
now and flares up.
it just blew up. I was in the St Andrews for a week.
Really?
Yeah, the whole side.
Oh,
of my head
oh,
blew up.
that was when you had what was it called? That's cellulitis.
Orbital cellulitis.
Cellulitis. Yeah, that's a
So
bad.
I put aftershave on it just to kill it.
Yeah.
Yeah, because that could flare up.
Yeah, tea tree oil and everything else,
Yeah,
yeah.
yeah.
But anyway, so I had this thing on my, and Esther's saying, what's that on your hair? And I said, oh, that's just a scratch, nothing
Yeah.
to worry about.
Yeah.
And then she went out for 3 hours to get some stuff, because I was managing a car boot sale the next morning, which I wanted to get up at 5 o'clock in the morning for.
Yeah.
Anyway, she got back about 6 o'clock that night, and Esther looked at my hand and said, oh, didn't you put betadine on it? And I said, oh, I looked for it and I forgot about it. Anyway.
Yeah.
Anyways, and Esther thought there was all this red streaks coming out of it.
Yeah.
Okay.
Anyway,
So,
and so
I thought it looked septic.
yeah,
Yeah.
and because Esther's had a septic foot from an infected
Blister.
It's best to get on it early.
Yeah, yeah. Anyway, but I didn't know this, but I had zero, absolutely zero white blood.
Yeah,
So
yeah,
it
that's-
was like
But they kill everything. That's the radiation.
Yeah.
The
Yeah,
radiation.
yeah.
That's
Yeah,
the
oncology,
thing.
chemo.
The
yeah.
chemo's killing.
Yeah.
Yeah.
Like normally it's between 8 to 10, and mine was 0.01. Like I had like one,
So you could have
So
gone to
basically you're
Indooroopilly-
anemic.
You could have gone to Indooroopilly shopping town and someone there with some sort of disease that you could have got
Yeah.
just like that.
yeah. But the thing
And
is,
she's like, oh, we'll wait overnight. And I was like, you could die overnight.
yeah, but this tiny little, like, this is, my doctor said to me, you don't, if you feel well enough, you can go out in public. He said, you're more likely to get an infection at home. He said, bad food, whatever. And anyway, so and I'd been out twice that week, once to the theatre and once to a dinner the night before. Anyway, and I had given blood. I'd had a blood test the day before, but no one had told me that I had zero
They wouldn't have
neutrophils.
known that. They
No,
wouldn't have been
no,
tested yet.
no.
So they
Yeah.
went to the lab.
Yeah. Anyway, so that, and I'm
Oh,
thought,
they should have
okay,
been, they should have been testing. for
yeah,
that, though.
yeah. Well, they should have told me about
Not straight after they took it. They still need.
Oh no, yeah.
Yeah, but this is more than 24 hours later.
Yeah, but they should have
Yeah.
been telling her this week's. You
Yeah.
know, I mean, listen, your immune system could be down.
Yeah. Well,
That's it.
my doctor said this: if you get a fever, come in straight away. He says, don't care what day it is, if it's an Easter Friday or whatever.
If it's
come-
2 o'clock in the
come on,
morning.
Yeah,
That was the problem with Ivan.
Yeah, oh yeah, I
Yeah,
know.
I know.
Yeah, or I even went to a party.
yeah.
Well, yeah. Well,
Yeah, he went to a party up the road.
I thought the issue with Ivan was that he had he had diarrhea, and the diarrhea.
Yeah,
meant
but he
the
went
drugs were
out. He went to a party up the
no,
road
it
as
wasn't
well.
a party. He told me that he had
He
a
had a
pie.
pie,
And
yeah.
I was, the minute he had that, and the fact
And then he got
was,
diarrhea, and the diarrhea meant.
But
the
what I'm
drugs
saying, the
were-
pie could have been the trigger of it. But
yeah,
yeah.
but he said the doctors didn't tell me about any of that. They just said if your
Get a
temperature
fever.
changes,
Yeah.
it comes straight up.
Yeah.
Nothing about anything else, like
No.
stomach pain or
Yeah.
Yeah,
So,
and it meant none of his anti-rejection drugs were working.
so that went from, and he he was sick on the Wednesday. He didn't go back in until Friday. By then it was
Too
probably
late.
too
Yeah.
late.
Anyway, Esther's telling me all this, and Esther's saying, and I'm saying it's okay. I've got a car boot sale tomorrow morning. I've got to, I'll ring my doctor, or if I feel worse tomorrow, I'll go in after the car boot sale.
Yeah.
Anyway, and Esther's saying, Mum, you can't do this to me. You can't ignore me and anyway, and have me be here to help you, and then not to take my advice.
But
Yeah.
See,
until you get a dose of reality, though, until you've had that
Yeah,
dose
yeah,
now,
yeah,
that hey,
yeah, yeah.
life is a pretty.
Esther did the right thing.
Esther's got a life
Esther
card
did
that she
the
can
right
pull out.
thing.
Yeah,
You owe me.
Yeah, but it's quite often.
Did the right thing.
She did the right thing.
Yeah,
Every
yeah.
single person we
And
saw
that-
along the way said Esther did the right thing.
Yeah, absolutely.
One by one, I was like, okay, registered nurse,
Yeah.
doctor, another doctor, oncologist. I'm for Mum's nil.
And everybody else in the family.
Yeah,
who
but
heard
that's
the
like
story. Yeah.
everybody. I
Yeah.
mean, that's even like when I
Yeah.
had my breakdown in
Yeah.
2009.
Yeah.
people will say, well, we knew there was something wrong. You know what I mean? But you just think, oh, well, I'm all right, I'm
Yeah,
all right, I'm all right, I'm all right, I'm all right.
I'm all right.
Just keep on going.
The day I broke my leg, laying on the bed. Come on, we're going out tonight. We're going to the gym. No, you can't stay home. Oh, you're not sick. Get up.
Well, I had a broken foot and I walked around on it
For 3 months.
For 3 days.
Or whatever.
And
Thinking it was just a sprain.
I went and got a pair of crutches from the chemist.
Yeah.
And before I finally thought, well, you know, I went to work every day for 3 days.
Crazy.
And then on my day off on the Thursday, I went to have it X-rayed, and they said you've got a broken metatarsal.
Yeah,
And then I
don't-
was in plaster for 4 months. Yeah.
Well, it's like me. I went to the doctor and they said, oh, you're suffering from mental and physical exhaustion.
Yeah.
And I went, what? We're going to give you 3 months off.
Yeah.
I went, what? Yeah, I mean, like,
Yeah.
Make it 5.
no, but if you know what I mean, but
Yeah.
in your own mind, you think,
Yeah.
oh, I'm coping, I'm all right. You
Yeah,
know what I
well,
mean?
anyway, this is Saturday night. Esther then rang the 1300 health line, and when I was out of the room, I was going off into the room trying to find the private number for my regular GP, because she
Yeah.
said ring me anytime.
Anytime,
Yeah. Anyway, so this is 8 o'clock on a 7:30 on a Saturday
Friday.
night. Anyway, and
Where's the GP live? Where's
the GP somewhere out in Camp Mountain or something like that.
out in the year?
Yeah. Anyway, but all I wanted really was to allay Esther's fears and have me continue to go to the car boot sale the next day and all that. Anyway, Esther separately went on to the 1300 Healthline, and then after doing a whole lot of the prep discussion, came into me in the bedroom and said, I've got the 1300 Healthline nurse on the line, and she needs to ask you some questions. So then she asked me some questions, and then I said, you know, I think it's just little. Esther's worried about it, but you know. And then they sort of, how long has it been since your last chemo? And you know, and I was actually in the middle of the nadir, of, they say, the lowest period. And then I said, oh, maybe you know, I've got a thermometer. Maybe I do
She was 1 degree over.
a temperature check anyway, because and I had because I had terrible neuropathy in my hands and my feet. I couldn't walk. They were so painful. I felt as if I'd walked through fire, and then people were driving nails into my feet. Anyway, so and I had taken a massive high dose paracetamol and anti-inflammatory ibuprofen pill about an hour before this. Anyway, so. And then the temperature came up as being 37.7, so it was spiked by 1 degree. But they said on the material that it was anything over 38, I had to come and seek medical attention immediately. Anyway.
So what we hit? 39?
37.7.
That's with the gut
With-
Panadol,
yeah,
with all the
exactly.
Panadol and all that.
So
Exactly.
So all this other stuff was probably pushing it down. And anyway, so I did and then the triage nurse at the 1300 Healthline said
You have to go to the hospital
Leslie.
in the next 1 to 4 hours.
Yeah. Well,
Well, that was good of her.
they don't want to be seen to be.
No.
Negligent,
No,
yeah.
and someone who's in the middle of a chemo nadir and all the rest. And Anyway, so and then I thought, well, they're going to be more conservative, so I'll pack a bag. I'll have a change of clothes for tomorrow. I'll take my toothbrush. I'll take some pajamas. And anyway, and so because to come back after 50 minutes either way is to get stuff is so I take my drugs. So I did that, and I rang the Icon Care after emergency hours number and said that you know, I've got something I don't think is very much, but my daughter's concerned about me. We've run the run.
She kept apologizing to them for feeling like a
I feel
fraud.
like a fraud. Anyway, and they put the message through to my doctor, who was not on that weekend, and he had a backup, and he rang me as we were driving in, and he said fine. He said he'll get a report from the emergency at the Wesley, and anyway, and then when I arrived there, the triage nurse said to Esther, "You've done the right thing." And then the emergency physician came in and she said, you've done the right thing. And then they were going to take a blood test. And I said, I had a blood test yesterday at Sanford. Would you not be able to get that? And so she got into the system. She came back in and looked a bit shocked. And she said, you have no neutrophils. She said, your number is 0.01.
Oh,
So the normal number is between 8 and 10.
Yeah.
And she said, we have to put you on antibiotics straight away.
Yeah.
Anyway, and so, and then she'd obviously communicated that back to the locum backup for my doctor, and he said to admit me and put me on a 24-hour drip. So they admitted me into this ward that was opposite the nurse's station, which I had zero capacity to get any sleep.
Yeah,
the doors just went open.
That's like MAPU or a holding ward.
So they're close to, and they put all these masks and everything else on and to talk to me, and made me feel
see, that is protecting you from me.
I know. Look at the butcher bird sitting in there on the floor there. He's inside wanting some food. Anyway, so
they're not doing it to protect themselves from you.
No, they're protecting me from them. Yeah, yes. I know that. I did know that, but it makes you feel very diseased nonetheless to have them do that.
It's like, Dad was put in, what was it called, the ward where they don't know whether he's got an infectious disease.
Oh, okay.
When he came back
HADS or...
Oh, yeah, when he came off the boat. Yeah. So
the
anyway.
nurse got upset at me not having a mask.
Yeah, so
well,
that's
the thing. Yeah. That's the thing. Yeah, again, you know what I mean? They're protecting their patients from you.
Yeah, they're for Mum for Mother's Day.
Beautiful.
So I couldn't. You were out doing your thing in the bus.
Yeah.
No, I was with Vanessa and the second daughter for Mother's Day.
But
so it didn't take you long to get back to normal.
They didn't give you a blood transfusion?
My doctor came in to see me on
They
the
didn't give
Monday,
you a blood
on the public holiday Monday, because that was the May Day Monday, and I said, look, in the real world this is nothing. He said, yes, Kathy, but you're not in the real world. And then he said, your daughter must be congratulated. Anyway, but and then they realised that I'd had this injection to inject myself with something to help boost my white blood cells. I've had one after each of the chemo sessions, but the one I did that time, I must spill some. I know I spilled it. It went on my skin. And I thought, should I suck this up or not?
Oh, do you inject it yourself?
Anyway, and then I thought, oh well, and I thought they had rung me on the Monday after each of the after it previously. I thought I'd tell them if they rang me, but anyway, he said to me on the Tuesday, you did take that injection, didn't you? And I said, yes, but it didn't work very well. And anyway, and then he started giving me this injection. But these injections are $1,200 injections.
Wow. And you spilt it.
I spilled it.
Of course you will.
Yeah, but if that's the price between life and death, then obviously $1,200.
That's right.
No.
Just be
Well, but all these people were really, they went out and I said, oh, that's not how you do it, to this nurse who was trying to give it to me. And she said, we've just been on the MICA database or something, or Mickey database. Apparently all these nurses just go back and go onto Google, medical Google, about how they do their jobs. Anyway, so they went on the Mickey database to see how to actually inject it. And they said, and they thought it was $1,300 worth. And I said, oh, well, my understanding was it's $1,200 worth, but they only charged me $40 to dispense it. Anyway, so
so you get a discount for doing it yourself.
I don't know. Well, maybe.
That's on PBS.
Well, it's probably still being researched. Anyway, so
so how many of those do you need? Just
one. Well, I had 2 last week. 2 smaller doses on the Tuesday and the Wednesday.
Do you get anything back from your private health cover for those?
And there's a lot. There's a big gap.
Huge gap.
But you haven't had to have a blood transfusion?
No blood transfusion.
I was reading the other day, the average, it's in the paper, I don't know whether you read it, the average breast cancer patient is forking out over $10,000 to cover their gaps.
Mine already will be 12. It was $3,000 for the test for the genetic test.
You're just in a fortunate position where you can afford that.
Yeah, well, it goes on my bank card.
But the thing is, a lot of other people can't afford
No.
But obviously, at the end of the day, $12,000 for your life is pretty cheap, I think.
Oh, sure. And I'm sure they're paying lots more.
Yeah.
Like just the admission last week and all the rest. Yeah.
Oh, I know. At work, people are dipping in their superannuation to have lap band surgeries
Yeah,
and all
yeah,
this kind of
yeah,
stuff.
Yeah,
Yeah,
no,
yeah.
actually, the insurance companies are letting them because it's supposedly a life or death situation.
Yeah, well, it is.
Yeah.
You know what I mean? Like, you know,
Yeah.
if they have lap band surgery, they might live another 20 years.
Yeah.
If they don't, they might die
No.
of obesity.
My,
like,
my
what's the-
son-in-law's getting that.
You only got to look at Debbie, how
Yeah.
she's improved.
Yeah.
Yeah, but Debbie's had twice. She
Yeah.
had a.
I think Debbie has she had the lap
Yeah.
band, or she's had
She
the
had-
stomach
She
removal?
had,
No, no.
she had a gastric thing.
She had the lap band first up.
Yeah, yeah.
Worked
That's-
for a little while, then it just
yeah.
fell apart.
Yeah.
Then she's gone back for a different op.
Yeah, well, she might have had her half her stomach
Yeah.
removed,
Yeah.
half her.
Yeah, yeah.
So
Yeah.
that's the most dramatic one.
Mm-hmm.
But obviously, the lap band one. That's the one Rosie had too. Yeah.
But from what I've been told, sometimes it'll work initially, but it's not a forever thing because the band actually breaks
Yes, it
down
does.
over
Yes,
time.
it does. Yeah.
Yeah.
Yeah. Well, it's supposed. That's what it's made to do.
And you're supposed to have changed your habits
Yes,
in the
and-
meantime.
and because you've lost a lot of weight, you're supposed to be healthier
Yeah.
and all
Yeah,
this kind of
yeah.
stuff.
Yeah.
But now a lot of people now are just getting half their stomach removed.
That just seems too dramatic. To
I
me.
did. I
Oh.
was told though it's not removed. It still sits there in your
It's
gut,
stayed-
but
it's
it's
stayed.
but it's.
But it
it's-
must have crows or something if it's not being sort of used.
Huh?
Oh well, instead of your stomach being that big, now it's only half.
Yeah,
you know what I mean?
yeah,
So-
yeah.
There's the in and the out of the stomach, so
Yeah.
they've got to connect the out to the first active half.
Oh,
I don't
okay.
know how the other half stays alive.